Namaskar viewers, hello and welcome to Sansad TV. I am Tina Jha, you're watching Perspective. Wishing all our viewers a very happy Dussehra and Durga Puja. Today on the program, we are going to talk about a significant milestone achieved by India of having further reduced child mortality rates. As per the sample registration system, the SRS Statistical Report 2020 that was released recently, India's under 5 mortality rate has declined from 45 per 1,000 live births in 2014 to 35 per 1,000 live births in 2019 and further down to 32 per 1,000 live births in 2020. Infant mortality rate has also registered a 2-point decline to 28 per 1,000 live births in 2020 from 30 per 1,000 live births in 2019. While neonatal mortality rate has dipped 2 points from 22 per 1,000 live births in 2019 to 20 in 2020. Total fertility rate, which is the TFR for the country, has also come down to 2.0 in 2020 from 2.1 back in 2019. While the crude birth rate at the national level during 2020 stands at 19.5, exhibiting a decline of 0.2 points over 2019. From 2015 to 2020, there's been a decline of 1.3 points in crude birth rate for the country. Now, the targets under the National Health Mission to be achieved by 2025 is to reduce infant mortality rate to 23, under 5 mortality rate to 23, and sustain total fertility rate to 2.1. So what is being done to achieve this target in the next 3 years? What interventions by the government have helped in rapidly reducing mortality rates in the country? And how can we end the urban-rural disparities is what we will try and understand on this edition of Perspective today. Joining me are 3 distinguished panelists. So let me begin first by introducing them to you. Pleased to welcome Ms. Urvashi Prasad. She's Director, Development, Monitoring and Evaluation Office, Niti Aayog. Dr. Usha Ram, Professor and Head, Department of Biostatistics and Epidemiology, IIPS Mumbai. And Dr. Sunila Garg, Chair, Program Advisory Committee, National Institute of Health and Family Welfare. Thank you to all my guests for joining me on the program today. Ms. Prasad, let me begin the program today with you. Let's first take an overview of how the states have been performing. So there's been a consistent decline in what we are seeing in the mortality rates, particularly infant mortality under 5 mortality rate. But if we look at the performance of states, which are the states that have seen significant progress in bringing down these numbers, and which are the states that are still lagging behind?
Yeah, so I think most of the states, the trend is towards a decline, which is what is very good news for us. Of course, some states, the decline has been much more significant, but in other states, less so. Regardless, pretty much across the country, the trend is to see a decline in these mortality rates. And I think what is also important to note is that in some states, the mortality rate has already at a lower level. So there you might not see as much decline. If you look at some of the southern states like Kerala and Karnataka and others, the baseline mortality levels are already relatively lower there. So you might not see a further significant decline. But nevertheless, overall, if you see the country, including the northern states, the eastern states, you are seeing the mortality rates declining. Of course, in some states, we have a larger distance to frontier, as we call it. So we have a larger gap that we need to fill. States like Chhattisgarh, for instance, Bihar, Uttar Pradesh, we have more distance to cover there in terms of reducing the mortality rate. But the overall general trend for the country is positive, that the rates are very much on the decline.
Absolutely, you're right. So this positive trend is something that's been reflecting in the last couple of years. Dr. Ram, what are some of the focused interventions that you think have worked well in bringing down mortality rates across the country?
So I think if I could take for last 10 to 15 years, our National Rural Health Mission, now that we call it National Health Mission, I think that has been the game changer for the country in terms of mortality reductions for under 5 mortality or infant mortality or neonatal mortality. And I would also add here maternal mortality actually. So what are the specific interventions that were made in National Rural Health Mission or NHM? Look at this couple of indicators if I can illustrate you. So for example, if you look at the antenatal care to the pregnant women, it has increased dramatically, not only for the nation as a whole, but also in the states, especially the one that Urvashi talked about, for example, lagging states where the under 5 mortality continues to be high. Even in these states, our antenatal care coverage or antenatal care coverage with content and quality has dramatically gone up. Institutional deliveries have gone up, and also the postnatal care within the 24 hours after delivery have substantially gone up. So these are some of the improvements in intervention coverage indicators which has actually resulted into the reductions in under 5 mortality rate, including an IMR and NNMR. Other than that, I think we need to also look at what were the programmatic changes within the NRHM, NHM framework. There were a lot of advancements in terms of healthcare service delivery, which made the healthcare delivery, particularly public healthcare delivery, accessible even in the rural areas or among people from the lowest wealth quintile. If you look at the trends over these past 15 years or so, the inequalities between richest and poorest group or urban rural, for example, have reduced significantly, meaning that our program is able to reach to the most marginalized population in this country. And that cut across actually all the states, whether these are high mortality states, as we call them, or the currently low mortality states, as Urvashi was flagging out in terms of our like whether it's Karnataka, whether it's Kerala, whether it's Tamil Nadu, Maharashtra, or Gujarat for that matter.
That's right. This, even though there's been a decline, you're right, and as Ms. Prasad was also saying, but the fact that urban-rural disparity is still there, and this is something that we need to now look forward to. Let me bring in Dr. Garg here. You know, the fact that there are three crucial factors. Some focused interventions by the government. There have been center-state coordination, so perhaps that is one area we work towards. There have also been some transformations in the healthcare system, and that's why this outcome has been attributed to the dedication of the healthcare workers as well. We've often seen the Prime Minister, the Health Minister of the country attributing this remarkable change to the dedication of the healthcare workers in the country. So if you could, you know, take us and our viewers through the some of the massive transformation that the healthcare system and particularly the working styles of the healthcare workers has taken place in the last couple of years.
I like to say that, you know, over a period of time, we are moving towards, you know, gradually attaining sustainable development goals. And as has been pointed out earlier, also 11 states have already achieved our under 5 mortality rate, you know, basically to less than or equivalent to 25 by 2030, which was to be done, but 11 states have already done that. And 6 states have already attained, you know, less than or equivalent to, you know, basically target of infant mortality rate. How it has happened now? Number one thing is that, you see, India is very huge. It is very diverse. Now, you know, we have got health and wellness centers, which are reaching the last mile, which are 150,000 in number. And out of which, you know, 100,000 are there basically, which are reaching, you know, which are almost having 12 task forces. That means we are talking of particularly the RMNCH-A services. We are talking of communicable, non-communicable diseases. Even if, you know, a woman during her pregnancy suffers from, you know, non-communicable diseases, she is at a high risk. That is one thing which is important. We have to see that. Another thing which is now made a substantial difference is that now the focus is not on quantity, focus is on quality. Now we have got labor room quality standards initiatives also, that is Lakshya initiative. Yes. We have got Suman, we have got Ma, that is mother's absolute affection. That means, you know, exclusive breastfeeding we are talking about. Another thing which is very, very important, which Tina, we have to realize is that under Sarv Shiksha Abhiyan, our women are more educated, they are more empowered, and we are paying a lot of attention, you know, when we talk of our frontline workers. They are not only working from the healthcare facilities, our ASHA workers or Anganwadi workers who are involved in providing, you know, supplementary nutrition or midday meal program. That is very, very important. And then, you know, empowering the women to control their fertility levels. That means we are now talking of fertility level of 2, which is again, you know, it comes from empowerment. Empowerment means she has to negotiate with a partner as well. So that is another important point where we have made the difference. And I will say that, you know, our universal immunization program is one of the success stories. We will say that, but still we have miles to go, as you really pointed out, that we do have a rural-urban divide. But, you know, with the health and wellness centers which are reaching the last mile, we will definitely be able to make a difference. And also, we cannot forget the fact that we do have a private sector also, because alone government sector cannot play an important role. Let me give an example of, tuberculosis, where, we involved the private sector, and we got substantial number of cases, reported from for tuberculosis, because for tuberculosis, our target is basically we have to, eliminate this by 2025, not by 2030, as per our Prime Minister's, Prime Minister's declaration that we should be working towards tuberculosis elimination. So, when we are talking of infectious diseases, including pneumonia, diarrhea, malaria, along with preterm birth complications, birth asphyxias and all, they can all be controlled by, right from you. It's a life cycle approach. It is not a one-day approach. So we have to begin right from adolescence to, good antenatal, intranatal, postnatal care, to the care of, newborn, to the infants, to the under fives, and that's how, it goes through the life cycle. So,
absolutely.
Ultimately, our healthcare workers, whether I talk of our frontline workers in terms of ASHAs or Anganwadi workers, which has been a success and declared by UN also, along with that, our ANMs, and our nurses and community health officers, which is a add-on in the whole process. They are working hard, and now we have got linkages through telemedicine, which has made a substantial difference in the whole game, so that even sitting at home also, or sitting at the primary care level also, we can get appropriate information. So we are talking of quality, we are talking of monitoring of all the indicators very, very carefully, and the time is not very far that we will be reaching our sustainable goals well ahead of time, as has been mentioned by both Urvashi and Usha also.
That's right, Dr. Garg. Ms. Prasad, we have to, address the disparities that are still persisting, and more so because the stark disparity is there between the urban and rural numbers if we look at. So what kind of focused approach do we have in terms of reducing these disparities?
Yeah, so I think, we are using a data-driven approach to identify where we need to focus. And that is where the data is very useful, because there are not differences just between states, but even between districts within a state. So ultimately, you need a very localized and very targeted approach, that why is a particular district lagging behind? And that is where we are trying to use data. What I will emphasize, just like Dr. Garg was pointing out, that there are certain interventions which are within the health sector. So access to health services, but there are also interventions outside the health sector which impact these numbers, right? So whether it's nutrition, whether it's education, whether it's housing and infrastructure development, it's poverty alleviation, ultimately all of these come together to reduce these mortality numbers. So not only do we need to intensify our efforts in the health sector, we also need to work on what we call the social determinants of health. And we need to address all these factors in a very targeted and with a very data-driven approach.
Professor Ram, there is not just the fact that urban and rural disparity persists. What's also worrisome, I was looking at the numbers, the under 5 mortality rate numbers show a gender disparity as well. So U5MR in females is higher, it stands at 33 as compared to males, which is at 31. How worrisome is this gender differential pattern, which is still persisting in the country?
So, no, actually you are right. We need to address gender differences in under 5 mortality particularly. I recall a study way back in 2013, which identified out of total 640 districts in this country at that time, 304 districts had female under 5 mortality 25% or more higher than the male under 5 mortality rate. So, and those districts are not only just in these so-called our lagging states of Bihar, Rajasthan, Chhattisgarh, Uttar Pradesh, Madhya Pradesh, but they are also located in developed states like Kerala, Karnataka, Gujarat, Haryana, Punjab, Tamil Nadu, Maharashtra. So they are cutting across all part of countries. And that continues. In fact, in the today's newspaper, there was a piece of article which says there are almost 8 states in the country where the female under 5 mortality rate is way higher than the male under 5 mortality. So certainly the issue continues. We do not have at this point in time any estimate of this gender differentiation under 5 mortality or an IMR at district level, because we don't have that kind of data available in this country currently. Although HMIS does provide some indication, but those data are always has its own limitation. If I'm sure Urvashi can talk about it a little later, that comes from the HMIS. But so this issue remains. And for that, certainly we need to work a lot more about creating awareness among families, not just women. Women empowerment alone is not going to do everything for us. Ultimately, it is the family which takes the decision. It is not only women alone who decides everything. We know what is the empowerment level in our country for women. Not every woman is able to even take care of a decision to take care of her own health. So under the circumstances, I think what is important is to create that enabling environment at the familial level, which makes it conducive for families to look at that both sons and daughters are same. There cannot be a difference when it comes to accessing healthcare or providing basic means, including feeding, nutrition, and so on and so forth. That's the way I look at it.
That's right. You know, Dr. Garg, that's a significant point. So this is, of course, societal transformations and evolution will eventually overcome these kind of problems that we've been facing. There have been progress in this area. But the fact that even though there has been progress in the health sector as well, if you look at the number, 1 in every 35 infants at the national level dying before their first birthday, how do we address that in terms of, and what are the factors that are still affecting it? In 2022, if we are losing 35 infants before their first birthday, what are the factors that are contributing? Is it access to healthcare, or is it lack of quality healthcare, or are there other issues that you look at?
I think it's a mix of all. So if we look at the contribution of neonatal mortality within infant mortality, it is almost about 80 to 85%, which means almost 80 to 85% of the infants, they die within first 4 weeks of life. Now, what does it mean? It means that the program factors are more important at this point in time in India if we want to further reduce our infant mortality rate, because the neonatal mortality is predominantly determined by program factors, which includes access to healthcare, which include quality of care, which also include making basic needs available to pregnant mother and children, not only when the woman is pregnant or when she is delivering in institution, but even after, when she is discharged from hospital, for example, after delivery. She needs to be provided with the care for what we call postnatal care, which currently is relatively at the lower level in many of the states. Some states have improved, as I said earlier, but there are states where postnatal care for both mother and child after 2 weeks of delivery is relatively low. I think we need to work more towards that area.
Okay.
And also, I think we need to work towards maternal anemia, as someone pointed it out earlier. The nutrition component is very important here. Early initiation of breastfeeding, I can tell you some analysis that we are doing, it does contribute to higher neonatal mortality rate if the breastfeeding is delayed after 1 hour of birth.
That's a significant point that you've made, that, you know, child survival cannot be addressed in isolation. It is intricately linked to mother's health, and therefore all of these programs have to be holistic in nature. They have to be more inclusive. Dr. Garg, as someone who's from this fraternity, earlier that question was for you, but Dr. Ram, you know, put forth her perspective and rightly said so. But the fact that these are shortcomings that we need to address, as someone from the fraternity, what are the shortcomings that you see in you know, child care, maternal care, of course, but also the fact that in providing basic health care to states where we are still lagging behind?
I think it is a very, very important question. We need to look at, you know, when it has been already pointed out that we have declined in terms of neonatal mortality rate by 2 points, but rural-urban differentials are quite very high. That is one thing. Number two is that when we talk about, you know, the quality care, that we have to, you know, address quality care both at urban, rural, peri-urban, and tribal areas across. That is one thing. That means when we talk of initiation of breastfeeding, as has been already mentioned, but also the mother has to be sensitized, or the families have to be sensitized right from the antenatal period itself, that, about the contraception part, they have to be sensitized about the initiation of breastfeeding part, and also importance of monitoring of growth and development. It is not only because every child needs to be monitored, whenever the child comes for immunization, like let's say the certain, vaccines are three vaccines are given at the time of delivery in cases of institutional delivery to the newborn, and then 6, 10, and 14 weeks. Then we talk about, 9 months, and then subsequently it goes on further. We have got, almost now 12 vaccine preventable diseases which are incorporated at the national or subnational level. So that is one thing which is important point. Another thing which is very important, from the perspective is that the woman empowerment, and we still see a lot of gender-based violence across the country. And it is gender equity and equality, which needs to be addressed at all levels, which is being addressed, but still gender-based violence is still quite very high, which we have seen across. So that one needs to be addressed as well. But also, timely immunization of the children, and all the facilities need to be equipped with, monitoring of the, childhood diseases, like when we talk of, pneumonias, or we talk of diarrhea, all these things, they need to be addressed as well.
Yeah. These are important aspects.
I just want to add one more point here.
Dr. Ram, I'll come to you. I'll come to you. Sure. Let me quickly get in a word from Dr. Prasad, because all of these aspects that you've mentioned, awareness is an important tool to perhaps address all of these hurdles, Ms. Prasad. So towards, spreading awareness, particularly in villages, in tier 2 and tier 3 cities, where there is a lot of scope for improvement when we talk about mortality rates, what are the kind of plans that we have in terms of familiarizing or making females particularly aware of their well-being and also the well-being of the child?
Yeah, so I think, awareness is important, and then we need to go beyond awareness to, community engagement. We need to actively engage communities in these solutions, because, often we think that we know what is good for people or what is right for them, but actually communities often have the answers themselves. It's about us working together with them. So it has to be a partnership approach. And in fact, even if you see, the Prime Minister has been stressing that we need to move from Jan Andolan to Jan Bhagidari, which means that, from community mobilization to community partnership. So whether it's in health or whether it's in nutrition, whether it's in drinking water or sanitation, which are also very important determinants of mortality rates and health and well-being. In all these areas, you will see that there is a huge emphasis of government programs on creating a Jan Andolan, and now increasingly moving towards Jan Bhagidari. So, of course, this requires not just the government. We require to involve our private sector, our civil society, our faith leaders, our community leaders. It really has to be a whole of society approach and not just focused on the government. But of course, the government has a very critical role to play as well.
That's right. Dr. Ram, you wanted to say something, and I'll also add one question that's going to be the last question for the program today. The fact that challenges for us are huge also because we have a large population. So in a couple of years, we are going to be the most populated country in the world, and that makes the task enormous for us. So in terms of moving ahead, what are some of the, indicators wherein we need to quickly improve our performance so as to achieve the desirable outcome?
See, we need to look at all the indicators with regard to, particularly if I was to talk of sex ratio, or we have to, monitor the fertility rates, or we have to look at the childhood indicators. And also we should not forget about the important indicator, that is maternal mortality rate. That is also important thing, why should we lose a mother, unnecessarily because of a simple thing like pregnancy? And, when we talk of a target from 103 to 70, this is also a big number. So I think I will tell everybody to see that there's a small Egyptian film which is Why Did Mrs. X Die? We need to look at social factors which are beyond. So that is also, we need to look from that. But particularly when we are looking at all the indicators from the maternal perspective and from the childhood perspective, from the fertility perspective, from the sustainable goal point of view, because these are very, very critical. So it is important to look at all the indicators, monitor them very carefully, so that we do not lose any mother or child unnecessarily, or we do have, large number of cases of malnutrition. So it is very important to focus from a holistic perspective so that, we reach the last mile with quality care.
Professor Ram, I have a little time left, so I could come to you for the last word.
I was just thinking, in terms of our urban-rural disparities, there is one important component that we also need to address is access to C-sections. If there is a huge unmet need for C-sections in the rural areas and also in the lagging states. Now, what do we do for that? For that, we need to create health facilities, capacities such that even at the block level, they are able to cater to C-sections. If you look at the reductions in child mortality in the lower mortality states, or what we call our empowered action group states, it is largely driven by the institutional delivery in the lower public health facilities, which includes the CSC and PSC and all that. And almost 67% of the institutional births in these states take place only at the lower level of health facility, where the C-sections are relatively less available. So I think we need to lay a lot of emphasis on that if we want to bridge the rural-urban gaps. That's going to directly help us. Other than that, what I think is it is important for us to look at area-specific program, as Urvashi mentioned. We have already identified some 117 aspirational districts in the country. And I think we need to put intensive efforts in those districts so as to bring the under 5 mortality level down. That's right. Very important for us. And the last point I think is important to look at or address the health, human resource in health sector, because that is a big challenge currently. We need to pay greater attention to make sure that our human resources are available all the way down at the village level when it comes to maternal and child health care.
Rightly said, Professor Ram. Perhaps human resource is one aspect that we missed touching upon, but that's a very important aspect, perhaps, that's coming as a challenge to us when we talk about reforming the health sector. So hopefully, with changing times and as reforms are taking place in every sector, this is something that will also be addressed very soon. We're hopeful because the larger implication of the health of a country has its direct bearing on the nation's well-being. And every economist goes on to say that it's very important. So while for a country which has a young population providing a demographic dividend for economic growth, it's essential that infant and children also be healthy. They're also well-nourished to improve the national wellness parameters. And that's paramount if we want to achieve the desired goals and if we want to achieve the status of a developed nation as the thrust has been put by Prime Minister Narendra Modi himself. That having been said, I'll have to wind up the program. Thank you once again to all my guests for joining me on the program today, sharing your thoughts with us and our viewers. Thank you, viewers, to you as well for your time. I'll see you same time tomorrow now with another topic. Until then, you take good care of yourselves and keep watching Sansad TV.